After being delayed by a year due to COVID-19, the numbers of those experiencing homelessness in the Kenora district are out, and it shows a considerable drop in the number of people considered homeless. Those numbers are being welcomed by the Region Services Board, which indicate that strategies they've been employing work. Adam Riley has the details.
The affordable housing shortage has certainly become a crisis across the north, and especially in our communities.
In 2018, the Kenora District Services Board announced 393 people in the district were experiencing homelessness, with the largest concentration in the communities of Kenora, Dryden, and Sioux Lookout, with 223, 67, and 66 people respectively. Flash forward to 2021, where the survey process was shifted to bring it in line with other districts with a snapshot in time model, which showed that number dropped to 221 people experiencing homelessness in the district, and once again, Kenora, Dryden, and Sioux Lookout being focal points, with 121, 37, and 36 people, respectively. The survey numbers show that of the 221 people, a majority of respondents were between the ages of 36 and 55, followed closely by the 26 to 35 age group, with 65 of those people stating they had first experienced homelessness below the age of 25, and a whopping 88% of them identified as Indigenous. KDSB Chief Administrative Officer Henry Wall says overall, the drop in numbers reflects the effort the board has put in place with various partnerships over the last 3 years.
In terms of having housing specifically built for the purpose of ending chronic homelessness. And, whether it's more supportive housing in Sioux Lookout, Kenora, Red Lake, transitional housing in other communities, we're starting to see that that is making a difference, that we are seeing less people experience chronic homelessness. We're seeing less people go through the shelter system.
Wall notes since 2011, the demand for affordable housing has grown by 346%, which is why housing projects have been given top priority to counter the issue. He says when he moved to the region 15 years ago, affordable housing was being directed towards low-income families and seniors.
You fast forward now, and that conversation can include healthcare professionals, nurses, police officers, paramedics, social workers who cannot find affordable housing or access to housing. And that is making it more difficult to address homelessness, because what we do need fundamentally is more homes. And then the other supports can do its job as well.
Wall says the focus for the next few years is to continue building new housing units, with projects in several communities underway or in the planning process, and believes with that strategy, homeless numbers will continue to decrease in the district. Adam Riley, TBT News.